there and welcome. I'm so glad you could join me today. There is something truly beautiful about understanding how the human body works, and today we are going to explore one of the most fundamental skills in medicine, the clinical examination. Think of it as a special kind of conversation, one where a doctor doesn't just listen with their ears, but with their eyes, their hands, and a few simple tools. It's how we ask the body questions and listen carefully to its answers. Together, we are going to take a gentle journey through the nervous system and the heart, learning how we can uncover the incredible stories our bodies are waiting to tell us. It's going to be fascinating. Let's begin with the motor system, the part of our nervous system that controls all of our movements, from a powerful leap to a gentle smile. The first thing a clinician looks at is the bulk of the muscles. We start by simply looking and feeling the muscles, comparing one side of the body to the other. Are they symmetrical? Do they feel firm and healthy? Sometimes we might see atrophy, which is when a muscle decreases in size. It might feel soft and a bit flabby. This can happen if someone has been ill for a long time. The opposite is hypertrophy, which is an increase in muscle size, usually from something positive like exercise. But there's a fascinating third category called pseudo-hypertrophy. Pseudo means false, so this is a false enlargement. The muscle looks big, but it's actually weak. We often see this in the calf muscles in certain conditions. To be precise, especially if we suspect atrophy, we can use a simple measuring tape to check the circumference of the muscles. To make sure the comparison is fair, we use bony landmarks, like the kneecap, to measure from the exact same spot on both legs. It's a wonderfully simple and effective way to track changes over time. Next, we assess muscle tone. Tone is the state of sustained, partial contraction in a muscle. It's a state of readiness. Think of a sprinter at the starting line. Their muscles aren't fully tensed, but they aren't completely relaxed either. That's tone. We check it by gently and passively moving a person's limb, like their arm or leg, and feeling the amount of resistance. If the resistance is too high, we call it hypertonia. If it's too low and feels floppy, that's hypotonia. After checking the tone, we need to know about strength. This is where we use something called manual muscle testing. We use a simple scale called the Medical Research Council scale, which grades strength from 0 to 5. It's much simpler than it sounds. Let me show you. Grade 0 means there is no contraction at all. Grade 1 is a tiny flicker of a contraction, but not enough to move the limb. For grade 2, the muscle can move through its full range of motion, but only if we take gravity out of the equation, perhaps by sliding the arm along a tabletop. Grade 3 is a big step up. The muscle can move fully against gravity. Grade 4 means the muscle can move against gravity and also against some resistance from the examiner. And finally, grade 5 is normal, full power against full resistance. Isn't that an elegant system? Now that we've looked at how the body moves, let's explore how it feels the world around it. This is the sensory nervous system. We can divide sensation into a few different categories. First, we have epicritic sensations. These are our fine detailed senses, like feeling the light touch of a feather or being able to tell if you are being touched by 1 point or 2 points close together. Then we have protopathic sensations. These are more crude or primitive feelings like pressure, pain, and temperature. And finally, there are deep sensations, which come from our muscles and joints. This includes our sense of vibration and, critically, our position sense, which is called the kinesthetic sense. This is your brain's internal GPS, telling you where your arm is even when your eyes are closed. A loss of this sense can lead to a condition where you can't identify an object just by touch. We test these senses with very simple tools. A wisp of cotton for fine touch, the examiner's thumb for crude pressure, a pin for pain, and test tubes with hot and cold water for temperature. Each one gives us a clue about how well the nerves are sending messages back to the brain. Next, let's talk about reflexes, the body's incredible automatic responses that happen without us even thinking about them. We have superficial reflexes, which are triggered by stimulating the skin. The most famous is the plantar reflex. When we stroke the sole of the foot, the toes should normally curl downwards. We also have abdominal and corneal reflexes, which cause muscles to contract or the eyes to blink. Then we have the deep tendon reflexes. This is the one everyone knows, the knee jerk. When a doctor taps the tendon below the kneecap, the leg kicks out. This is the patellar reflex. We can also test the biceps and triceps tendons in the arm and the Achilles tendon at the ankle. There are also visceral reflexes, like the pupillary light reflex. When a light is shown into one eye, that pupil constricts. That's the direct response. But what's amazing is that the pupil in the other eye also constricts. That's called the consensual response. It's a beautiful sign that the wiring between the eyes and the brain is working perfectly. Sometimes we see reflexes that shouldn't be there. These are called pathological reflexes. The most well-known is Babinski's sign. In this case, when the sole of the foot is stimulated, the big toe goes upwards and the other toes fan out. In an adult, this is a clear sign of a problem in the central nervous system, specifically an upper motor neuron lesion. Now, let's meet the 12 special nerve pairs that connect directly to the brain. The cranial nerves. We test them one by one. For the first, the olfactory nerve, we test the sense of smell with something pleasant like coffee. For the second, the optic nerve, we check vision with an eye chart. Nerves 3, 4, and 6 all work together to move the eyes, so we test them by having the person follow a finger with their eyes. The fifth nerve, the trigeminal, controls the powerful chewing muscles and sensation on the face. The seventh is the facial nerve. We ask the person to smile, close their eyes tightly, and puff out their cheeks to check for symmetry. The eighth nerve is for hearing, which we can check with a finger rub or tuning fork. Nerves 9 and 10 are tested together by watching the palate rise when someone says "ah." The 11th, or accessory nerve, is tested by shrugging the shoulders against resistance. And finally, the 12th, the hypoglossal nerve, controls the tongue. We simply ask the person to stick their tongue out. Of course, all these systems rely on a healthy pump and plumbing. So a key part of the exam is the cardiovascular system. We check the arterial pulses in places like the wrist and neck, feeling for the rate and rhythm. We measure blood pressure. Then we listen to the heart with a stethoscope, a skill called auscultation. We listen at 4 key areas on the chest that correspond to the 4 heart valves. We are listening for the 2 main heart sounds, S1, which sounds like la-bi-bi, and S2, which sounds like da-bi. These are the beautiful rhythmic sounds of your heart valves closing as they diligently pump blood through your body. Finally, there are a few special examinations that give us even more information. For example, we might need to check for a leg length discrepancy. We can measure for a true shortening, which means one leg bone is actually shorter than the other, or we can measure for an apparent shortening, which might be caused by something like a tilt in the pelvis, even if the bones are the same length. And to test for coordination, we look at the function of the cerebellum, the part of the brain responsible for smooth, controlled movements. We might use the finger-nose test, where a person touches their nose and then the examiner's finger back and forth, or the heel shin test, where they run the heel of one foot down the shin of the other. These simple tests can tell us so much about how well the brain is orchestrating movement. So you see, the clinical examination isn't a single event, but a wonderful collection of observations. It's a story told by our muscles, our senses, and our reflexes. It's a way of appreciating the intricate and elegant design of the human body. Thank you so much for joining me on this little tour today. I hope you found it as exciting and empowering as I do. I'd absolutely love to hear your thoughts or answer any questions you might have. Don't be shy, let's chat about it in the comments below. Take care